How can you shorten the assessment and increase its quality? Clinicians in neurorehab spend a significant amount of time assessing. In fact, over the past 2 months, I collected some data about this. I asked clinicians, how long do you spend in assessment? The data shows that clinicians spend a lot of time in assessing. If you take that data, you can say that on average, a clinician would spend about an hour and a half on assessment. Furthermore, this data comes from physios, OTs, and speech pathologists who are working either in acute or inpatient rehab or community services. So each one of those clinicians in each one of those stages averages an hour and a half of assessment. It adds up to over 13 hours of assessment per patient. Why does it take such a long time to assess? Assessment, approached clinically, is a way for the clinician to find out what the problems are. So they assess various things to identify what the problems are, so then they know what to treat. I suggest to flip that model the other way around. What if we could find the problems first and then go and assess specifically those problems, in fact, assess them even deeper? Brain imaging allows us to flip this model of assessment so that we know what the issues are before we actually see our patients. Recently, I used this model on a patient. It was a complex patient that I needed to assess and treat within an hour, and I halved my assessment time to be able to then continue and deliver an effective treatment. My point is that brain imaging can change the way you assess. It reduces your time of assessment and it increases the quality of your assessment. If you enjoyed this video, please like, subscribe and share. And if you want to learn more about how brain imaging is used in rehab, I invite you to join me for the 2-part free seminar series I'm running, and I'll be using case studies to discuss how brain imaging helps. I look forward to seeing you there, and the link is below.